So good morning. Today we are going to discuss about pneumonia. So what is pneumonia? Pneumonia is basically the inflammation of alveoli. The fluid with WBC or white blood cells gets filled in the alveoli and obstructs the gaseous exchange process, and air pathways get blocked. So the terms associated could be tachypnea, tachycardia and hypoxemia. So there is a change in sound patterns, breathing patterns. E sound like A, so there is egophony, so there is pleuritic chest pain, tactile fermitile vibration of bronchial breath sounds. So these are the basic symptoms. Now we are going to discuss the types. These may be CAP, HAP or VAP. CAP is community acquired pneumonia, HAP is hospital acquired pneumonia, and VAP is ventilator associated pneumonia. So CAP may be associated with COPD or basically people with alcoholic inclinations. So now we need to characterize these kinds of pneumonia. So this could be curve 65, CURB 65. C is for confusion, U is for uremia, R is for respiratory rate, C is systolic blood pressure, and 65 is the age. We need to characterize the patient as outpatient, inpatient or ICU patient. Having numbered 0 to 1 are outpatient, having a parameter 2 can be patient, 3 to 5 are ICU patients. So the outpatients can be treated with dioxycycline and azithromycin, while inpatients need to have an intravascular ampicillin. In ICU, we can use ceftazidime or vancomycin. Ciprofloxacin won't be very effective. In inpatients, we can also use moxifloxacin and levofloxacin. Now for empiric antibiotic, so the symptoms could be lobar pneumonia. When we can see diffusion of interstitial pneumonia, and we can see cystic fibrosis. There is a recurrent pattern. So we can have a urine or antigen test. This can be seen usually in soldiers living in barracks or living in close proximity. So the water associated pneumonia could be linked with Legionella pneumonia. So there is a pattern of bradycardia. The heart rate remains the same, but there is fever associated. Hyponatremia, SIADH, this can also be detected with urine test. And for viral pneumonia, we can see cavitation, and this can be treated with itraconazole. We can have a sputum culture for VAP and HAP, VAP inpatient treatment. This can be treated with ceftazidime. We can also use vancomycin MRSA. So there is another kind of pneumonia called aspiration pneumonia. So this is associated with neurological disorders as well. We can see lung abscess, refusion, and emphymia. So emphymia is basically seen in patients having pH less than 7.20 and glucose level less than 60. The good news is this can be treated with vaccines. We have vaccines called PCV 13 and PPSV 23. These are sequential vaccines. This can be given for the patients having age more than 65, and only once it is required in patients with less than 65. Again, we can recapitulate what we have discussed. We see cough and fever, labor, consolidation, interstitial infiltrate, pleural effusion, cavitation. So there is dullness and bronchial breath sound. Thank you.